it. The stream has begun.
And as we say, Sean, action.
All right. Well, welcome everyone. My name is Sean Savage from the VProject. The VProject, we were asked a couple weeks ago to shine a bright light on what our hospitals are experiencing with this COVID-19 surge and ask the community to help our hospitals. So our medical institutions have been excellent in collaborating over the past couple of weeks as a coordinated communication plan was developed, which is launching today.
Sean, can I stop you just for a second? Have we admitted everybody from the waiting room? Because I'm showing them not admitted.
All right, hold on, just one little. Aaron, are we good?
It looks like people are coming on.
They're coming in. There's still people joining.
Yeah.
Okay, let's hold a second.
Yeah, I just didn't want anybody to miss anything, Sean.
No, I agree.
No problem, Chris. Yeah.
Good, we got a nice turnout.
Yeah, so.
That was just the test start, Sean. Test.
You're going to test on anybody, test it on me. That's okay.
That's right. Yep, they're slowly, just not slowly, they're quickly coming in here. It's a nice group of folks. I think we're almost 100 people. I think we can go now. Chris, you agree?
Yeah, it looks like everybody's out. Hopefully all our media friends were here on time.
Yep.
Yeah, go ahead, Sean.
Okay.
All right.
Cheers.
Welcome, everyone. My name is Sean Savage from the VProject. The VProject was asked a couple weeks ago to shine a bright light on what our hospitals are going through right now with the COVID-19 surge, and really ask the community to help our hospitals at this critical moment. Our medical institutions have been excellent collaborating with us over the past couple of weeks and collaborating together to form a coordinated communication plan, which is launching today. Represented today is Mercy Health, UTMC, Wood County Hospital, ProMedica, McLaren St. Luke's, Toledo Clinic, along with Eric Z from the Lucas County Health Department and Ben Robeson from the Wood County Health Department. A collaboration like this community has never seen. I welcome Mayor Wade today. The mayor has been a strong supporter of the VProject from day one, and we are grateful for that support. Mayor Wade.
Well, Sean, thank you for your leadership in leading the VProject. We want to thank members of the community who have been with us on this journey now for, well, in terms of the pandemic, almost 2 years. I know the VProject hasn't been around quite as long, but the virus itself, it's almost exactly 2 years. The first American died from this almost exactly 2 years ago. I think it was 2 years ago last week. So to our population that is understandably fatigued and worn out by now almost 2 years of dealing with the pandemic, I want to thank you for staying strong and doing what you need to protect your health and that of your family and your community. And the big thank you today goes to the healthcare providers who are represented on this call. Sean alluded to it, but it's right on the money. This is a collaboration of literally all of the providers of healthcare services in our community, all of them, in a collaboration that has never quite happened like this before. I don't think it's an exaggeration to say that the sort of cooperation and collaboration among sometimes competing health systems has never happened before in our community. And it's a credit to them and their unity of mission and spirit that they are all together speaking with one voice at this critical time as we battle the pandemic. Really what we want to say is, let the healthcare providers help you. What they are going to be saying is, let us help you. The power of a message coming from your doctor, your healthcare professional, is so much more powerful than coming from my voice or Sean's voice or anyone else's voice. There is a level of trust and reverence for the opinions of healthcare professionals that I think at this moment in time is so very crucial. And that's why I guess I just want to end my very brief remarks by thanking not just Sean, not just the leadership of this group, not just the public at large, but very specifically the 100% of the healthcare system in this community for coming together and collaborating in this way so that we can finally do what needs to happen to put these two very challenging years behind us. So back to you, Sean.
Thank you very much, Mayor. Appreciate it.
Sean, before you go any further, we're having some folks that are asking to record this and they need permission to do that. Aaron, I don't know if you have that ability to give them permission. I just want to make sure that everybody's got what they need for the news this evening. So,
Yep, just take a pause. Aaron, are you good with allowing Andrew and Josh to record? We are recording, so we should be able to give them a link right after that, Chris.
yeah, they should be able to record it. You just have to give permission. And I think you can give
Aaron, are you able to find out how to let them record? He's got a lot.
Normally I see a request come up, but I do not see requests. Oh, here we go.
Great.
Kurt Frank just gave permission.
Perfect. Okay, is that good, Aaron?
Thank you. Sorry for the disruption, guys. I just want to make sure that they are able to
Sure, that's why we're doing it. That's
turn this around this evening.
Yep.
Thank you, Chris. In an effort to support our hospitals and the community, the VProject has created a campaign around what we are discussing today. And that campaign will be for print, broadcast, and social media. We're now going to play a 30-second PSA that's just been created, and it'll be seen here for the first time and hopefully by the broader community in the coming days.
When is the last time a hospital asked you for help? We are the doctors, nurses, and healthcare workers that you depend upon in critical times. Now is our critical time. We need you to help us help you. We ask you to get the vaccine. It's tested, it's proven, it works. The moment you receive the vaccine, your body begins producing antibodies, which combat the COVID-19 virus and its variants. We save lives every day. Help us by saving yours.
So the big black bar on the side is not part of it, a little technical glitch there, but you'll see it on social very soon.
Yep, thank you, Steve. And I have several questions for the physicians. And as the mayor said, that's really, we're here to listen to the physicians. And then we'll open the floor for reporters to ask questions. We've pulled together physicians from all the healthcare systems to give us firsthand accounts and answers to what is happening and how we can help as a community. We're going to start with Dr. James Tita from Mercy Health to talk about the situation in our area hospitals. I'll turn it over to Dr. Tita.
Thank you, Sean. I appreciate the opportunity. As a pulmonary critical care physician, I've seen firsthand at the bedside the toll that this pandemic has taken not only on individual patients, but also on our community. This fourth surge has us seeing more patients who have COVID than at any other time during the pandemic. Indeed, it's estimated that about 750,000 new cases a day nationwide are being recorded. Hospitalizations and deaths have not increased by quite that amount, but still, because of the sheer numbers, it has really put a stress on our hospital and healthcare systems. On a per capita basis, Ohio has one of the highest hospitalization rates in the country. Coupled with this surge in patients, we are also facing an unprecedented shortage in our caregivers. It's been estimated that since the beginning of the pandemic, we've lost nearly 500,000 healthcare workers, and this has severely strained our ability to care for patients. As a result, hospital systems throughout the country are struggling to care for and continue to provide the high care and high level of care and compassion that our patients expect and deserve. I also want to point out just how sick our patients are. Of the nearly 600 patients in our Mercy facilities in the Toledo region, probably 25 to 30% of them are hospitalized with COVID. In our ICUs, nearly 50% of our critically ill patients are sick with COVID pneumonia. And I also want to point out that during this surge, it's not only affecting the elderly, which was the case early on in the pandemic, but we're seeing much younger patients who are just as sick as the older patients were earlier in the pandemic. Also, it's important to point out that in the state of Ohio right now, 92% of patients who are hospitalized with COVID-19 are unvaccinated. And of the patients who die in Ohio with COVID, 96% of them were unvaccinated. So once again, it's very important to get vaccinated. Also, this influx of patients has affected our emergency departments. At any given time, patients who come to the emergency department for whatever reason face very long waiting times to be seen. Of those that need to be admitted, they may spend days in the emergency department before a bed becomes available. I would like to remind those that need testing for COVID that a partnership between Mercy Health, ProMedica, Lucas County Health Department, as well as the Ohio National Guard has set up a mobile testing site at the Lucas County Rec Center. They have the ability to do about 1,500 tests per day, and I would strongly recommend that those seeking testing avail themselves of this resource in our community rather than come to the emergency department just for the purpose of getting tested for COVID. It's a very valuable resource. Turnaround time is about a day, and certainly an important part of our ability to manage this phase of the pandemic. Finally, I would like to ask everybody to mask. We know that masking limits the spread of the virus, not only in terms of protecting ourselves, but more importantly, in protecting our communities, and also for those who are unvaccinated to get vaccinated as your best defense from getting seriously ill or dying of COVID pneumonia.
Thank you, Dr. Tita. Those numbers are jarring. And there are several reasons for that. Dr. Michael Ellis from UTMC is joining us. What's causing the surge?
So to echo some of the things that Dr. Tita already said, that really there's two things that happen. There's the virus characteristics, and then there's the human part of this. So if you look at the virus, it's mutated enough from the original strain that it's able to evade the immune system enough so that people who had already had COVID in the past or for those who had been vaccinated, they are still able to be infected, and they're still able to transmit the virus to others. The virus has some other characteristics where it multiplies faster than the original strain, and it creates a higher number of viral particles in the airways that can be spread to others. Now, if you take this essentially new virus and you place it with what's going on with people these days, well, we've just had the holidays with Thanksgiving and the holidays in December and Christmas and New Year's and all these gatherings. And then you take the cold weather where people are going to be naturally more indoors. That just gives more opportunity for the virus to spread. I'll echo again what Dr. Tita said, that although this Omicron strain can evade the immune response from a vaccine, still the vaccine protects against severe illness, so hospitalization and death. So just like with the other hospitals, well over 90% of the folks in our hospital are unvaccinated, and certainly the deaths, well over 90% of the deaths that occur at UTMC are in unvaccinated patients. So I would again strongly encourage that people get vaccine. It may not prevent infection, but it prevents people from being admitted to the hospital and prevents people from dying.
Thank you very much, Dr. Ellis. Great advice. We are hearing a lot about the contagiousness of Omicron, especially as it relates to children. And the number of pediatric COVID cases has risen exponentially. My understanding, in the past week alone, 580,000 children nationally were infected. We asked pediatrician Dr. Jennifer DeLucia to join us and speak to that. So are you seeing more COVID cases in children? And if so, how bad? And are there certain age groups that are getting hit particularly hard?
Definitely. We are seeing a lot more COVID cases in children with this wave of the infection. As you said, it's been an exponential rise in COVID cases for kids. For the week ending January 6th, there were more than 580,000 child COVID cases that were reported. That represents 78% more cases than the last week of December, and 3 times the amount of cases from 2 weeks ago. So it's risen very quickly. The other thing that we're noting is that the hardest hit right now are actually ages 4 and below. And that's a huge change from any other time throughout this pandemic. Some of the reason is possibly just the fact that that age group is not eligible to be vaccinated. We're still seeing with the children, just like you're seeing in the adults, and just like they're reporting throughout the country, that the majority of children that get admitted to the hospital for COVID are children that have not been vaccinated. In fact, in adolescence, you're 10 times more likely to be hospitalized if you are unvaccinated than if you are vaccinated. Locally right now, there are several children with COVID pneumonia. And we're also seeing other kids that are admitted for other illnesses who are testing positive for COVID. And that's harder on the healthcare workers as well, because those kids need to be isolated. They need special nurses. They need everything else to be separated from the rest of the kids on the ward. Other thing that we're seeing with kids is that testing is working very well. There are some parents that are asking, well, can you really test kids and get a result? And how should that change your behavior? The testing is really important. Layering protection, just like we've heard already in this press conference. Masking, distancing, hand washing, good ventilation, vaccinating being the most important, but adding to that the testing. If my child's home from school today because he's got a runny nose or a headache or a cough, The ways that you can test are, and again, I would say please stay clear of the emergency room unless the child is having trouble breathing. Some pediatric offices can test, but the testing center at Lucas County and at the health department can do children as well. The other thing that we're recommending is rapid tests. You know, rapid tests, there have been some question online as to how good they are, but those rapid tests are pretty good. They are actually at least as good as a strep test or a flu test that can be done as an outpatient. They have a very high negative predictive value. And since Omicron has a very high viral load that the patient carries in their nose, you very, very rarely get false negative results. And please do also do the test in the child's nose and not in the throat. So that's where we're at with peds, Sean.
Thank you, Dr. DeLucia. And I will add, and this is really for our media partners as well, we have 103 pediatric providers that signed an endorsement that was put together by the VProject relative to recommending the vaccine. I don't know of any provider, pediatric provider in our community that didn't sign that. So I think it's critical that parents, they trust their pediatricians for sure. Please look up if your pediatrician is recommending it. I can say with a high degree of certainty that they are. So I think that's critical and we need to get that word out. We're joined next by Dr. Brian Kaminsky. And really it's not just about the number of COVID patients in the hospital, but there is a trickle-down effect as all these hospitals have indicated. So here to talk about that is Dr. Kaminsky from ProMedica. How does that high number of COVID patients affect the hospital system, staffing, and the ability to treat patients?
Sure. Thank you, Sean. Thanks for including me on this panel. And, you know, I don't want to repeat all of the valuable information that the others have said, but I will focus on the hospital systems as well as the emergency department. So with the high volume of COVID patients that we're seeing coming in addition to those regular illnesses that present during this time of year, it's just led to an overwhelmed state. And so speaking in particular about the emergency departments, when the hospitals get backed up, that causes the emergency departments to get backed up. And when we start boarding patients in the emergency department, it makes it harder to see that next new patient that's walking through the front door or that next new patient that's coming in by ambulance. The only thing that the emergency departments are able to do to provide any sort of relief to that situation is to go on EMS bypass. What that means, it doesn't mean that the emergency departments are closed, but it means that we have to divert ambulances that are trying to bring patients into our emergency center. And over the past month, every single emergency department in our system has been on bypass to some extent during that time period. There have been multiple situations where every hospital in our system, in our county, has been on bypass, and that creates this red alert type of situation. We still receive patients in the emergency department, but it's different when we're on red alert. So what that forces Lucas County to do is it causes them to rotate, and instead of bringing patients to a geographical location that's closest to that patient's home, they may have to drive across town to go to a hospital that hasn't had a patient recently. It also affects our wait times in our waiting room. So patients start to pile up and wait long hours in the waiting room, which we obviously don't want to see that at all. So there is a huge downstream effect that this has. The other thing is that when we're on a red alert status and every hospital in the county is on EMS bypass, EMS will also go on alternative standards of care protocols, which means that when they would ordinarily just transport anybody that calls an ambulance and needs to be transported to the hospital, they'll actually use criteria to determine whether or not that person, based on standards under these alternate methods, truly needs to be transported to the hospital, or they can wait and see their doctor later, or they can come into the hospital at a later time. Again, it's a situation that we don't want to be in. We want to see everybody that, based on their judgment, feels they need to be transported to the emergency department where we can evaluate them. But when we're full with patients and we have admitted patients in our emergency departments, we have to stem off the flow some way. And that's how our Lucas County EMS systems help us slow down that flow. So we're really in a situation where because of the high volume and because of the volume of COVID patients that we have, we're having to operate under different standards that generally leads to a different type of care than we've had before. And we want to get back to that same safe and effective care that our community is used to. We have very robust hospitals and healthcare systems in this community. And when you look at other areas of the country, we have more options than most. So in all other areas of the country, if you were to go receive care, you'd probably be a little bit disappointed because the options are fewer and the amount of available providers and hospitals and emergency departments is fewer than we're lucky to have here in Northwest Ohio. So we really want people to, first and foremost, get vaccinated and then continue. I know that we're all tired and we're fatigued, but we want people to continue those preventative measures, the masking, the distancing, and the hand hygiene. When you go out in public nowadays, it seems like everybody has allowed that fatigue to set in. And although masking isn't mandatory, it's really rare to see somebody out in public wearing a mask. And right now with Omicron, it really is all that more important to do so. So those are the effects that we're seeing in the hospital. So, please just, we urge people to get that vaccine. Testing frequently is also really good if it changes behaviors. So it's good that we have more testing options as well. So that's really the status in the emergency department and across our systems.
Yeah, thanks, Dr. Kaminsky. Really appreciate it. And we've been in the middle of this now for 2 years. And the question is on everybody's mind is how much longer? And Dr. Wayne Bell from Wood County Hospital is here to talk about what we may expect in the next, say, 6 to 8 weeks, but also on a longer term basis. So we've also been hearing about promising treatments from Pfizer and just want to get an insight into when we could expect those to come online in our community if they haven't already. Dr. Bell, the floor is yours.
Good afternoon, Sean, and thank you. Good afternoon, everyone. Well, in Wood County Hospital, we're going through exactly the same things as all the other physicians have reported to you already. I immigrated from Canada in 1995, 26 years ago, pretty used to stacking patients in the emergency room. I never thought I would see it here, but lo and behold, here we are. So we're in the same situation as all the other hospitals. Our emergency room has been on diversion as well. We try to keep people out of our emergency room for testing, and our hospital has an urgent care center, the Falcon Center. We do a lot there. We did about 1,000 PCR tests last week. We had about a 42% positivity rate, which is similar to everywhere else in the state. As far as treatments, well, it's difficult to get the medication. So the new medications from monoclonal antibodies, when I checked this morning with our pharmacist, we had enough to treat 3 patients, but we're expecting 20-odd doses overnight. As far as the Pfizer drugs, which is sort of like the Tamiflu concept of treating, we haven't received any Paxlovid at all. We did get 100 treatment doses of the Merck product today, and they're available for outpatient use. How long is this going to last? I don't have a crystal ball, unfortunately. It appears if we follow the South African data and data elsewhere, maybe 2 or 3 weeks we'll see a settling down of it, but honestly, I just can't predict that. I would ask everyone to follow the advice that all of our other physicians given here today. Get vaccinated. It's your best protection against severe disease. We all seem to know someone now who has had COVID, even those who have been vaccinated. But believe me, the ones who are vaccinated have a less difficult time and certainly are not as much risk.
Thank you very much, Dr. Bell. Appreciate it. And we like you on this side of the border. We want to ensure we have the resources available when our friends and neighbors need them. And there are ways that we can help. So we have Dr. Stephen Baisley from McLaren St. Luke's, who's here to tell us what the public can do to help alleviate the stress on our healthcare systems. Dr. Baisley?
If the public wants to reduce the stress on the current pandemic, please get vaccinated. The vaccination rate in Ohio, unfortunately, is only about 60%, probably 55% that are totally vaccinated. Unfortunately, that's not as good as many of our comrade states in the area. please get the vaccine. A vaccine is designed to prevent disease. And so if you get the vaccination, you are less likely to get COVID, even the newer variants, and less likely to get that sick with the COVID. And as the previous physicians have told you already, the people who are in our EDs, who are in our ICUs, who are on our ventilators now, are far and away those who are not vaccinated. So please, please, please get the vaccination. That's the only way we have to really treat this. There are treatments out there, but not that effective right now. If you've got if it's been 6 months since your vaccination, please get the booster.
It's always good.
The booster is what helps people not get the infection. So please, please, please get the booster to maintain your immunity to a higher level. As a family doctor in this situation, when we have someone, we have a triage system. If they call the office and they have symptoms which might be COVID, which are quite numerous at this point in time, we ask them to please get a test, so at least we have an idea of what's going on. In my office, I don't have a medication that's going to treat COVID infection. I can treat wheezing if wheezing is going on. I can treat headaches and things along that line. But again, in my office, I'm not seeing that many, because generally, if they're triaged and they have a positive COVID, we give them some symptomatic treatment over the phone. And then if they have major issues or they're having trouble breathing or something along that line, unfortunately, that's going to mean a trip to the emergency department. So again, not much I can do in my office. This is what I can do in my office. And I don't know if you can see this or not. A mask, the surgical mask, the rectangular sort of thing with the little loops, far and away, it beats the cloth mask. And also, the mask need to be over the nose. And so every day when I see people, I see the nose seems to have pushed the mask off itself. And so therefore, please, 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 when we're talking to people about masking, yes, over the nose is the best way to do that. Getting a vaccine is simple. It's a question of going on the VProject.org to sign yourself up. But again, if we are going to beat this, we really need to get more people vaccinated. And I feel sad as an Ohioan to realize our rates are not as good as many, many other states around the country.
Dr. Baisley, thank you. One of the purposes of today is to get that rate higher in our community. And I know there's a lot of people out there who aren't vaccinated and may think it's too late. I've waited this long, I might as well not get one. So Dr. Carl Fernandez from the Toledo Clinic joins us to talk about that. Carl, is it too late to get vaccinated?
It's only too late if you're in the ICU, Sean, or hospitalized. It's never too late before you get in the hospital or have COVID to get vaccinated. That's the recommendations. And as many of the esteemed physicians have already said, our treatment for COVID vaccine, especially in the critically ill, is not as effective as we would like. And I do pulmonary and critical care, and I've been here since March 2 years ago fighting this. The vaccines offer us a unique opportunity to prevent serious illnesses. That means you may get admitted to the hospital even, but you won't most likely die. And the statistics are quite clear on that. So it's never too late to get the vaccine. Once you have COVID, then you should wait several months and then get the vaccine. It's also important, very important, to get the booster. In the ICU, the majority of our patients are not vaccinated, but we do see patients who have gotten the vaccine in January, February of last year, and then have failed for whatever reason to get a booster. And those patients are in the ICU. Generally, they do have typically milder illnesses than the non-vaccinated, but it's really imperative that they get the booster because, again, as many pointed out, it's a strain on the hospital system. It's a strain in the ICU, and all our healthcare workers, our nurses, our respiratory therapists are fighting tooth and nail with the physicians to help stem this onslaught of hospitalizations. But we can only fight so much. Once we are out of resources, once we're out of ventilators, once we're out of beds, there's not much else we can do. So I ask and plead that you guys get this message out. Everybody should get vaccinated. Those who are on the fence, get vaccinated. Those who haven't gotten their booster, get vaccinated. It is critically important at this time right now. Mayor Wade had said a couple back when the vaccines were going to be available, he hoped that we could all go to Mud Hens games and things like that. And I also felt that way. And it doesn't seem like we're going to be making much progress unless we get more people vaccinated. And I'm a Buckeye, and I want our numbers to go up.
Well, Carl, thank you very much. Dr. Fernandez, I get the privilege of probably talking to Dr. Fernandez maybe once a week or so and get some insight into what he and many of the physicians in our community are dealing with every single day. And I tell you what, it's heroic, the work that they're doing. And it's also the insight of what they see with their patients once it's too late to get vaccinated. Dr. Fernandez told me at one point, just kind of that look in their eye that they know if they could undo it, they could redo it, that they would. And so I think it's just critical that that word get out. We will, at this point, open the questions to reporters for anybody on our panel. And that includes our health directors. I'll at one point come in with a question for the health directors as well. But at this point, do we have questions from our reporters?
From the media team, if you're not being unmuted, just go ahead and put something into the chat and we'll make sure that you get there. And Andrew has
a question from Andrew at WTOL.
Yeah, I'm sure Aaron's looking to find him real quick.
Yeah. Hi, thank you. This is really for any of the healthcare people that are on here. At the start of the pandemic, when the governor, when state leaders made the decision to close things down, mandate masks across the state, his argument for that was obviously reducing deaths, but to make sure that our hospitals didn't become overwhelmed. Is what we're seeing right now, is this our hospitals becoming overwhelmed, surgeries being canceled, National Guard having to come in, some hospital systems telling workers who are positive but showing no symptoms to still come into work because that's just where we're at right now?
I would say Ben or Eric, maybe you could take a stab at that.
I'll go first, Ben, if you don't mind. I do believe that was definitely what the governor wanted to do. And if you see a lot of those tools in the toolbox, we're not utilizing right now. The doctors were very keen on this. People are not doing what we did, a year and a half ago by wearing face coverings when we go out, to social distancing as much as possible. So that has led into, I think, increased numbers. But I do believe too that it is a fatigue that it's been going on for 2 years. I think it's a culmination of things like the fatigue. I also think that just the virus that we have right now, the Omicron variant, has just magnified the issues that we're seeing right now. Ben, any thoughts?
Well, certainly, I think when we are noticing an overwhelm in our community, falling back to those precautions that we have worked with before are a great way to reduce the impact of the spread of the virus within our communities. But the other thing that we want to focus on too is that there's a lot of COVID within our community circulating, and there's a very high risk of being exposed right now because of how high the case rates are. If you get your vaccine, or if you've already gotten your vaccine, if you get your booster, you change the trajectory of what your experience is likely to be should you encounter COVID. Not only do you reduce your risk of getting disease, but you increase your likelihood of being able to recover at home if you do get sick. And this is a huge thing that we can do right now to help our hospitals, is give ourselves the best chance to reduce the impact on our communities, not only just individually, but when all of us together are getting that vaccine, it reduces the risk on our hospitals as a whole collective system. And then also when we're really vaccinated, we find that the rates of transmission drop as well. Here in Wood County, The most vaccinated group in our whole population are 65-year-olds and older. Because they have a high rate of vaccinations, nearly 3/4 of them are boosted at this point. Their incidence rate is lower than the rest of the population because their vaccines work together to reduce risk. So there's a huge benefit right now for being vaccinated, in addition to using those other precautions. But as we move ahead and COVID continues to evolve and change, the vaccine is going to give you that underlying level of protection to ensure that you can address that infection effectively, individually, and within the whole community.
Thank you,
Andrew,
Ben.
just one point real quick for, at least for Lucas County. Just like Ben said, there is substantial disease in the community. Our numbers are staggering in Lucas County. The other day we had 967 new cases. The day before that, 831. The day before that, 915. The day before that, 917. Last year, we were concerned about 500-600 cases in a day. And right now, the amount of disease in the community is staggering.
Sean, people are talking about, the hospitals being overwhelmed, but on a personal level, the nurses, the healthcare workers are being overwhelmed. For them, it's going to be unsustainable pretty soon. We're all in this for 2 years. And you have things like ER nurses and doctors taking care of patients in the ER for 2 or 3 days that should have been up on the floor in the hospitals, and the outlying are rural hospitals. Those patients are stuck in the ER. That delays care until they can find a bed in one of the bigger hospitals. So it has a ripple effect in the community, and it goes on a personal level to the physicians, to the healthcare workers, all. And so, yes, there's the numbers you can look at, but there's also intangibles, many intangibles. How does a nurse who's exhausted after shift react with her kids when she gets home? What do the husbands and wives do? Those are intangibles that are overwhelming people right now.
I would just like to add that early on in the pandemic, we had no other strategy to control the virus other than to lock down. And it did work. I mean, we bent the curve. Currently now, we're in a situation where we do have effective strategies. We have vaccinations, we have monoclonal antibodies. I think we're doing a little bit better in terms of critical care. But so to lock ourselves down now, we would have to contend with all the adverse effects that go with a lockdown, effect on mental health, substance abuse, suicide, and all of those things that went along with the lockdown as well. And that's why it's so important that people avail themselves of the vaccines as our first line of defense, and do those things that we know do work.
Thank you, Dr. Tita. Any other questions from the media at this point?
Yeah, if the media could just let us know who you are in the chat, then we will find you and get you on.
So we have Kate Snyder from the Blade with a question.
Just a second, we will find Kate. We've got over 110 people on. Okay, we have her. So Kate, if you want to go ahead.
Yeah, can you guys hear me?
Yes, we have you.
Just to piggyback off the previous question a bit and to get more specific, what exactly is the status of elective surgeries? Are they being postponed, and are employees and staff being asked to work if they are testing positive and have no symptoms?
Dr. Kaminsky, could you address that?
Sure, I'm happy to address that based on what we're doing at the ProMedica system. And This is something that we have long meetings to discuss, and we look at the existing guidance that's out there, and we generally follow the CDC guidance. Up until very recently, we've been trying to do everything. So we have been continuing with surgeries with very few exceptions, and keeping all of our departments open and functional. And then in the last couple of weeks, we actually backed off on some of that. So we are canceling elective surgeries, still allowing those more urgent emergent surgeries to continue because of that necessity. And the CDC has guidance based on what staffing levels are in terms of whether or not you allow workers to come in sooner after having COVID, or you continue with those traditional quarantines. So we have been following the 10-day guidance that had been established since the last year of the pandemic, and most recently the CDC reduced that to 5 days. So we consider that contingency staffing, and so we've paralleled the CDC guidance there. We are not asking staff members who have active COVID symptoms to come back. They have to meet that 5 days. They have to be improving. They have to be fever-free. So what we're doing right now is considered contingency plans in accordance with CDC guidance, and we are not having people come to work outside of that 5-day period.
Thank you, Dr. Kaminsky. Kate, do you have any other questions, follow-up?
Okay, any other questions from our media partners?
As we're waiting on anything else, I do want to ask Ben and Eric one additional question, and that's just for the community. In terms of what you're doing with your vaccination clinics and kind of just what the community can expect in the coming days and coming weeks.
Hey, Ben, go ahead.
Thanks, Sean. What we are doing is continuing to offer clinics here at the health department regularly. We have 3 standard days that we offer vaccines here in Wood County at the health department. Mondays from 1 o'clock to 5 o'clock. Tuesday evenings from 4 p.m. to 7 p.m. And then a small window Thursday morning as well from 9 a.m. to 11 a.m. We have some Saturday clinics planned. We just had one this last Saturday, and another one is planned on January 29th. And then in addition to that, we are also partnering with our school systems to make clinics available within the schools. And you can find all the information about our available clinics on our website. If you go to woodcountyhealth.org and follow the information for COVID-19 vaccines, you can find our full schedule there.
Not to trump you, Ben, but VProject.org does have a link to Wood County, as well as Lucas County and all the other. So it does, you can obviously go directly to Wood County or Lucas County, but we also have, through our organization, the ability for people across the community to access clinics.
In Wood County Hospital, we also have walk-in clinics at Wood County Hospital 3 days a week as well, and a day a week in our Falcon Urgent Care Center.
Thank you, Dr. Bell. Eric?
Yeah, Sean, thank you so very much. Yeah, our vaccination clinics at the health department run Monday through Friday. And they're from 9 to 3. Please check our website, the VProject website as well, for any additional late nights, because we will have those we're still running out of the rec center, and that rec center right now are going to be running at night on Wednesdays from 4 to 8. And then on Saturday, we'll be running clinics from 9 to 1. Again, we want to make sure that we're able to allow the community that ability to get in on those off hours, but also then too, the rec center is where the National Guard is going to be testing during the day. So testing of the day and vaccinations at night. I do see there is a question in the chat about the testing at the rec center. We are saying test return in about 3 days. We're finding out that tests are returning in about 24 hours. So our stressing for those individuals who want to know about the test return is 72 hours.
Thank you.
Sure.
Well, with that, I want to thank everybody. And the one thing I'll conclude with is, and I think this is for our entire community, we have relied upon our hospital systems for decades to take care of us. Most of us who have lived here our entire lives, had our children in your facilities, have had parents, who have been treated and siblings been treated in your facilities. The lives that you've saved over the years is unbelievable. And I think at this point, the community needs to recognize and acknowledge that it's really up to all of us individually to help you at this point. None of us can undo what's already happened. Somebody that's in the ICU, unvaccinated, we hope that they'll be able to stave it off for sure. But those that are at home unvaccinated, as Dr. Fernandez said, you have that opportunity still. It's not too late. So we appreciate everybody coming on. I'm in awe of everything you do every day, we appreciate it and keep at it. So thank you very much.
Thanks, everyone.
Thank you, Sean. Thanks,
And
everyone.
I'll also acknowledge
Thank
Steve
you.
Hansen, Chris Peterson, Sandy McClendon, especially for everything they did in preparation. It's been remarkable, all the work that they've done. So thank you.
Thank you for inviting us.
Thank you.
Thanks, guys.
Okay.
Bye.
Carl, you look so tired.
He does look tired.